My name is Dr. James Mackay. I'm a consultant genetic oncologist in the Cancer Institute in University College London. And I'm also the UK and international medical director of a company called Everything Genetic Limited, EGL, which is a UK company which offers inherited cancer genetic testing to our customers. So I plan to give a short presentation this afternoon, following on from what Peter Padrick has said, essentially looking at the minor differences between the UK strategy and what Peter has presented. So I plan to give a short presentation on genetics-based personalised cancer prevention activities as we envisage them in the United Kingdom. So this is essentially the strategy which we intend to follow in the UK. I think it's important to say that we have a very strong collaboration between Everything Genetic Limited, company that I'm medical director of, and Antegenes in the UK. And our aim between the two companies is to democratise inherited cancer genetic testing. And what I mean by that is we want to make accurate genetic testing available to as wide an audience as possible, but for a reasonable price. And that is very important. We will offer our testing services to patients with cancer and individuals without cancer, who have no cancer, who wish an accurate risk of developing a specific cancer over the next 10 years. And at the moment, we have 4 different antigenes tests available for breast cancer, colorectal cancer, prostate cancer, and for melanoma. One of the major ingredients in the UK service is the concept that we provide pre-test and post-test clinical support to all our customers. Pre-test, before they have the test, we give information about the purpose of genetic testing, possible results from the test, and the possible clinical consequences of the results from these tests. And then after the test, after we've got the concrete result back, we discuss the test results report and the individual implications for that patient, and then consider what management options are available for that individual patient. The ultimate aim of clinical support system is to ensure that there are no unexpected surprises for the individual when the test result comes through. And the important area is that the patient feels that the clinical service is always available for them. So if they have questions later on after they've had a test, they can come back to our clinical support service and ask them then, and we can clarify the position. So at the moment in the UK, slightly different from what Peter described in Estonia, we are offering a combined strong gene panel and a combined weak gene panel as a combination to all our customers. So we don't pick out specific people to offer a strong gene panel. We offer the combined strong gene, weak gene panel to all customers. And when I mention a combined panel, what I'm talking about is a combination of monogenic testing, as Peter described, and polygenic testing panels. And the reason that we're keen on providing the combination is in the normal population, without a family history, around 1% of customers will have a mutation in one of the strong genes. If that individual has a family history, that figure goes up to around 7% will have a mutation in one of the strong genes, which is why we believe that the combined strong gene, weak gene panel gives a much more accurate and reliable result. I appreciate that the cost of the strong gene panel does vary across different countries. And so in some countries, that combination may not be cost effective in some countries. But within the UK, EGL have managed to get the price of our combined panels down to a reasonable level. Everyone that we have spoken to so far believes our price is reasonable for the UK private sector. We'll come on to the public sector in a minute. At the moment, UK insurance companies will not reimburse inherited cancer genetic testing offered to unaffected individuals. So at the moment, we're in the self-pay market. We are working to try and persuade these insurers to agree to reimburse these tests, but they won't at the moment. But our ultimate aim is to reach a price that's affordable for the combined test for NHS patients. In order to pursue that aim, we are setting up a large prospective multi-centre study offering both monogenic and polygenic testing to study recruits in the normal population. That study will gather evidence on the mutation pickup rate, cost effectiveness, and clinical utility of offering these tests, the combined strong gene, weak gene tests, to a normal population. And using that information, we will then model changes in the cancer mortality rate, which comes from the strategy of offering these tests to a normal population. Of course, driving the test price down will maximize the cost effectiveness of this strategy. And what it does do is allow us to establish an evidence base, which we can then present in order to facilitate adoption by the NHS, the public sector in the UK. So EGL, in collaboration with Antegenes, offers accurate, affordable testing with interpretation of the clinical consequences of an individual's test result. Individuals who have an increased cancer risk from the testing over the next 10 years are advised to consult either their specialist, hospital specialist, or general practitioner. And the specialist or general practitioner will arrange and manage appropriate screening program for that individual based on their risk profile. So we in EGL do not offer cancer screening programs. We offer the testing and interpretation service, and then we ask the customer to go back to their specialist or general practitioner to manage and arrange the screening program. We expect that different clinical units across the UK will offer a variety of screening programs for the customers, which will very much be based on local practice, and we accept that. So as I understand it, the focus of EXPO is on looking forward into the future. But we already have tried and tested inherited cancer genetic tests available. So for us, our future mission is to raise professional and public awareness of the availability of these innovative tests and encourage their adoption into routine clinical care. We will welcome expressions of interest from international colleagues who wish to offer these tests to their customers. And I personally believe that the adoption of this testing program into the normal population, as we have outlined it, will reduce cancer mortality in the short to medium term. And we look forward very much to hearing your comments in the question and answer session, which will follow the presentations. So I hope that you found that short presentation on our strategy of bringing in these strong gene, weak gene panels into the UK with the aim of making these innovative tests available to the normal population. We would be very interested to hear your impressions of what we've said and your comments about our strategic plans. But in ending, I would say that EGL as a company is extremely grateful to Antegenes for our very strong collaboration, and particularly for the opportunity to present at this prestigious event in EXPO. Many thanks.